Welcome here. We are so thrilled to be on this journey together. I hope you hear that. I hope you feel that. We have a lot of fun in these institutes. It's really a great journey inward. Part of what this is a leadership institute. So part of what we're, as Hema said, we're really trying to nurture who you are as leaders as well, and invite you into a new kind of leadership, or a leadership that really is firmly rooted in a kind of a inner love and inner strength. That then both for yourselves and also as a team. One of my favorite quotes, and you have to sort of follow me along here now on this quote. The quality of an intervention is dependent on the interior condition of the intervener. And that's what we're after. The quality of the intervention depends on the interior condition, the quality of the interior condition of the person or the group that's intervening. So that's what we're about. And so we really invite you to enter into that, to bring your full self. Next time we're going to spend a lot of time talking about language and different perspectives. This is a faith and public health institute. Not everyone here may consider themselves a person of faith, but that's okay. We are inviting people to really bring their full, if you don't use faith language, you might use a different way of expressing kind of what's at your interior, what's in your center. So, kind of be in that spirit of openness. We have a diverse group, and we really invite you into, a very exciting conversation together about what it means to address health disparities, health inequities, to create transformational change in our communities. Okay, so you see here this tree. And in a minute, I want to just stay here so we can all see the tree. But in just a minute, we're going to transition over here to the circle for this next part, okay? But I want you to look at this tree for a second. This tree should be impossible, right? How could a tree grow out of rock? And that's what we're going to be talking about in the next session, is how can a tree grow out of rock? And I really want you to pay attention to that, where those roots are, and what those roots are doing. Because that's sort of where we're really going to focus, is on that crack, where the roots and the rock meet, and where the tree comes out of the rock through that crack. What's in that crack that makes it possible for that tree to be growing out of rock? So we're going to kind of be pretty deep in this next session. And we're going to be pretty deep, I think, in the afternoon too, when we have Dr. Murray come and speak with us. But health disparities is a deep topic. Health inequity is actually a really, you have to be deep if you're really going to think about transforming health inequities. They're rooted in really very complex, very just really deep causes. And so we have to go deep in order to meet them. And so that's sort of what we want to do now, is to really kind of prepare ourselves and really think at a deeper level about how are we about transformation, no matter what our project is, no matter what is the realm where we work, how do we really get to transformation? We want, everybody's got a project, we want activities, we want to get things done, but what we also really want you to think about is how do we not only just do an activity, but actually how do we transform? How do we create transformation in the communities that we serve, for the people that we serve? How do we actually really be about the business of transforming health inequities to health equity? So I invite you over to the circle. If you need to make a stop along the way, a pit stop, please do, but let's try to come over to the circle as quickly as we can. What I'm going to talk about now is actually some ideas that I've been working with for a while, and I hope that you feel that this is really a conversation, because these are things that I'm thinking about and wondering about. I don't know that I've got it all sewn up, and so I really want your input on this too, your wisdom on this as well. So as I talk, feel free to jump in and say, oh yes, I know something about that, or oh, this reminds me of this story, or whatever. But what I want to talk about is the tree, and how the tree is growing in the rock. And how I call it is, I call it as hurt and hope. So what I'm going to do is I'm going to draw hurt and I'm going to draw hope. And then we've got this great space right here where those two things come together. So hurt, when we're talking about health inequities, our good friend, Gary Gunderson, who you'll be hearing from in a couple of months, I think in August, he's kind of our, what is he? He's like our uncle, who's like our wise, he's like,
he's our sage.
He's our sage. He is our wise sage. He's really, I think, one of the great thinkers about how faith can address health inequities. So there are a lot of people that think about spirituality and healing, or faith and healing. He really thinks about faith as a critical component for creating transformational change in community. So just a wonderful guy. Anyway, he calls the hurt part, he doesn't talk about hurt, I talk about hurt, but he talks about this hurt part as a wicked cauldron. And what's over here? Like if we're cauldron. Okay. Cauldron. So when we're talking about health inequity, health disparity, what's in this wicked cauldron over here? What do we know about this? And we're going to hear more. We're going to hear more than we want to know this afternoon from Dr. Linda Ray Murray, who will tell us pretty much everything that's in that wicked cauldron. But just like for those of you who have a thought about it, what's over here in this wicked cauldron that creates health inequities? Sickness, racism, poverty, fear, hate, trauma,
Education inequity,
crime, education, greed. All right, so, okay, fear, okay. All right, so we're going to hear more about this afternoon. Is it this afternoon or later this morning? This afternoon. Okay, so we have a pretty good idea about this wicked cauldron thing over here. Now, on this side, our friend and uncle and wise sage, Gary Gunderson, talks about how he noticed when he worked in public health, how one of the things that public health is really good at is identifying the leading causes of death, the things that make us sick and that make us die. He said public health is really good at identifying those things. And he's pretty clear that what he wants to do is not just think about death, because for anyone who works out of an asset-based philosophy, one of the things that you learn, or an appreciative philosophy, is that your energy follows sort of what you talk about. And so if you talk about death, that's sort of where your energy is going to go, is toward death. He wants to talk about life, and what are the leading causes of life for our communities. So I'll put these 5 down here, and we can talk about them a little bit. And feel free to jump in if again, if this is something that resonates with you. So the first one that he talks about is one that I love, and that's really a big part of my own experience, and both as a person of faith in a community of faith, but also in community engagement, and that's connection. Connection. So what is connection, and why is that a leading cause of life? Any thoughts on that?
You're talking about relationships, say?
Yeah.
Connection. Yeah, Being with
Right, being with people, being connected to other people. What else?
Love.
Love. Uh-huh.
commonality.
Commonality. Mm-hmm.
Unity.
Unity.
Encouragement.
Encouragement. Yeah.
Understanding?
Acceptance.
Mm-hmm.
Yeah.
Understanding.
Acceptance.
Acceptance. All of those kinds of things are part of how we connect with each other. And there is deep power in the connections that we have with each other. There's some really compelling research that talks about social isolation. Now we're sort of back over here. Social isolation being as bad for your health as smoking, being obese, being a substance abuser. That actually people who are well connected socially have better outcomes than even people who are, healthy in other ways. That's remarkable to me that this connection piece actually so impacts our physical being, our physical bodies, our what did you call it? Notice our physiological, our physiology.
Yeah.
It's amazing. It's really amazing. So connection.
Because we are interconnected, no? We all
Yes.
are interconnected in the sense of oneness.
Right. Yeah. So this connection thing is something that we know about as people, and that all of our religious traditions teach us about. And so when we think about leading causes of life, think about yourself as a leader and your own interior condition, and think about connection and how that feeds that. The next one that he talks about is coherence. And what he means here is how we make sense out of things. A sense that things make sense, basically. That's one of the causes of life. When we have a feeling that we understand and we can make sense out of why things are happening or where our life is. Like, Hema's great story of you took your experience of woundedness by this stupid guy who hopefully is every day trying to be a little less stupid, who said that you weren't bright. You were able to place that experience within the context of your religious tradition that said, do no harm, be nonviolent, be a peacemaker, be a peaceful person. And so you were able to interpret that experience in the light of your religious tradition. So connection, coherence. Anybody want to say anything else about the coherence part? Agency is another leading cause of life that he identifies. What might we mean by agency?
You feel like you have the ability to do what needs to be done.
Right, exactly. So you feel like you've got some power, some capacity to act. A lot of people in our communities may not feel that way. They may not actually feel like they have the capacity to act. But when you do have that feeling, that's a really core part of what it is that creates a sense of life and life-giving for people in their communities. Other thoughts about that, about agency, about how you see that? Anybody have an example of how they've seen that working?
Coalition come under that.
What's that?
Coalition.
Coalition?
Yeah.
People coming together in coalition? Mm-hmm. Yeah, to feel like you even have the ability to pull people together. Yeah. All right, so connection, coherence, agency, blessing, and then he also calls it generativity or intergenerativity. I'll just put an inter up here. So this is really an interesting idea, and it has to do with how we feel connected with those who have gone before us and with those who are coming after. It's sort of being able to be in this space where you can sort of touch your ancestors, you can touch those who have fed you and have brought you along, as well as being able to see to the future and to be able to think, what is what we're doing now going to touch those who come after us, our children? So, that sort of being able to sort of balance back and forth and being able to sort of be in touch with this continuum of life and of experience. Just a very kind of concrete example of it. When I go to my own church, it's an old church, it's a historic church, and it's the original pews in the church, and I love sitting in those pews, and the wood is really smooth. And I always think, and it's sort of worn, in that way that wood gets, where it's sort of, you can sort of see the differences in color where hands have touched it and the oils from people's hands. And I'm always, every time I'm in church, I think about all the people who've sat in those pews before, and and who will sit in those pews going forward. I mean, it's just a very tangible way of sort of being in touch with this just amazing gift of people who have journeyed there and who have created this place, and the kids who are there and who will have their own kids there maybe in the future. So let's move on to the next one, because we still have to. There's a whole bunch of stuff there in the middle too that we got to get to. And so the last one is hope. All right. The last cause of life, hope. And we could spend a lot of time. I don't know what more I can say about hope. I mean, that's it's a very, all of these things are very subversive. Connection, coherence, agency, blessing, generativity, hope. These are subversive, very powerful subversive things when we're in the wicked cauldron. Hope seems impossible. I mean, the tree seems impossible, right? It seems impossible that we could actually claim health equity for our communities, that we could actually claim a world where everyone has enough, where everyone is healthy, where everyone is able to live out their fullest calling and potential. That seems like, why would you even say that? But we know that we continue to live in that hope because we have experiences. We do emerge as the butterfly. The metamorphosis does complete itself, and you do come out the other side. And again, we could tell a lot of those kinds of stories. So, but I'm not going to let people get started on that because. So this is hope over here. And this is hurt over here. And you could use other words for this besides hurt and hope. Those just happen to be the ones that I use, and they come from they actually come out of a great theologian within my tradition, who says that this theme of hurt and hope, at least in the Judeo-Christian tradition, is kind of the core story of our tradition. This movement between hurt and hope, and the power that lies at the interconnection of those. So that's sort of, but it's present in every religious tradition, I think. It's not just unique to the Judeo-Christian tradition. Okay, so in this center part, I identified a number of things that I think are really kind of in that crack where the root takes hold of that tree, in the crack of the rock. What's in there that allows that tree to flourish? I guess that's the question I'm asking here. And there are three main things. Now, I just added a whole bunch of things that I heard people talking about: vulnerability, this kind of internal commitment, sense of teaching the future, reaching. What I wrote down: reaching for teaching, teaching for the future, having a sense of identity. I mean, some of the things we talked about. But the three things that I wanted to identify. The first one is something that we call moral imagination. moral imagination. And so what moral imagination is talking about is that within us, we have an internal sense about what's right, about how things should be, about what you're in your one quote that you had from the Buddha, the kind of the final word, the final way to figure out if something is true was, does it seem to connect with reason, and does it promote the good of yourself and of the world? And so that's sort of, moral imagination is this deep inner wisdom that we have about how things should be. And then we also have this in our faith traditions. So when we think about faith in public health, faith as an integral part of transformational change in our communities, this thing of moral imagination is really critical, because if we can't imagine it, if we can't see it, it's really hard to work toward it. And this is one of the gifts that people of faith bring, is they bring the vision, which may also be a public health vision, but there's a way that people of faith can talk about this vision that is that really gets beyond just sort of structures, that really gets into, sort of this kind of out of this world call for how we can be together. And this is so critical and so important to kind of maintain the energy and the life for the work that we're doing, to have this sort of prophetic, this moral vision for how things can be. So moral imagination. The other part of the imagination part has to do with creativity and a capacity to kind of manage in complexity. To be able to say, we know that things are complex. We know that things are not simple. And so we have our part of our moral imagination is about seeing how very disparate things can fit together and not have to be in conflict with each other. So an imagination, a creativity, a willingness to kind of be in ambiguity. That's what the moral imagination is about. And that's part of the ground that the tree seed sits in that allows it to take root and begin to sprout. And that's the kind of thing, when we're thinking about engaging faith communities, one of the things that I'm really going to push us on is to not just think of faith communities as places where we put programs, where we put in our program and they've got a captive audience and we're so glad they can get the word out to all the people about how they should act. But to actually think about, how do we use the moral imagination of faith communities in this project to transform the health of our communities? How do we use the prophetic word that comes out of that faith tradition to speak and to be a leader in our community about how things should be? And we see this in our communities. We see how people are doing this. Okay, so the next thing that we talk about is spirit power. We have had a very close colleague by the name of Jim Ben. He was a minister in the United Church of Christ, but his earlier career was as a community organizer. And he was a community organizer in the steel mills of Western Pennsylvania, and out here in the Gary area, he organized in the steel industry there. So he was a hardcore Saul Alinsky community organizer. And then he got faith along the way. And part of what he realized is that we need more than just kind of hardcore community organizing. The main principles of community organizing under Saul Alinsky's teaching, and there may be other people here who know more about it than I do, but one core principle is you don't take on a challenge that you don't think you can win. And part of what Jim said is, actually, if we did that, if we really just took on challenges we think we could win, we would never have had the civil rights movement. Dr. King would never have. He would have just kept preaching in his in his church, and that would have been the end of it. You know, Rosa Parks would you know, have sat where she was supposed to sit. This idea that we can do more than what we think is possible. There's a great progressive writer, a social justice writer by the name of Jim Wallace, who wrote a book called The Great Awakening, I think it's called, where he talks about great social movements and how faith, or some element of faith, he doesn't call it spirit power, but some element of faith actually was key to making that happen. You know, and you can sort of think about how people of faith, leaders of faith, voices of faith have been at the heart of most, if not all, major social movements for change. The other thing that Alinsky organizing talks about is that there are two kinds of power. There's people power and there's money power. And if you want to change things, you have to have people, you have to organize people, and you have to organize resources, money. And that those are the two pieces that you critically need. And so Jim said, actually, you also need a third kind of power. You also need spirit power. You also need this sort of audacious, you know, kind of this audacious idea that you can do something that seems impossible. And if you have that, then that's when you get transformational change, not just a change in a structure, but actually transformational change. All right? And then the third one is one that we're really exploring and really trying to take seriously love. As something that can be a resource in communities, that actually can be that transforming thing for people. Love is, it's not a simple thing, but it's a powerful thing. And we know it's true. Everyone here knows it's true, knows that love can transform everything, everything. But it's really, it's a process to actually practice that. It's not simple, but this, to me, is so core to everything that we're doing. If we really want to see change in our communities, if we really want to see the kind of new community, new reality that we can see with our moral imagination, this love thing and how we act together as people, how we are together as people, how we accept ourselves, how we kind of love ourselves, and how we nurture our own internal condition, and how we are able to express that, isn't just a kind of fluffy thing. I mean, this is a real thing. One of our projects that we're working on right now through the Center for Faith and Community Health Transformation is a project that actually gets its name from a commission on infant mortality that was convened by the Joint Center for Political and Economic Studies. So, and they're part of some other big institute, which I forget what it's called right now, but because also had a really long name. But what this commission did is they kind of looked at what's at the root of infant mortality disparities in our country, and what they came up with. Okay, now this is the Joint Center of Political and Economic Studies, and these are people who are policy wonks, and these are people who are academics. And what they came up with is that the core issue, the core reason that they saw for disparities in infant mortality was relationality. It's an issue of relationality, both individual relationships, but also structural, how we relate to each other as a society. And they said that it's not only a matter of providing good prenatal care and access to care for women, it's actually also an issue of love. It's how we express love to each other in our communities. And they entitled their report, "The Courage to Love." And this just tickled me. that this was like a serious report that came out of this commission. And so we're actually working on a project in the Auburn Gresham community with partners there to really explore. I mean, the whole point of the project isn't to do something right away. It's actually to explore how is love already alive here in this community, and how do we begin to pull together the love assets and the love activity that's here in a way that actually creates and is protective for women and for families and for babies to help eliminate disparities and to lower preterm birth and infant mortality in this community. So we're on a journey around this idea of love. And again, I think we could probably all tell a story about how love has been transformational in our lives. So we need to wrap up. There are a couple things I wanted to say just in closing. I'm just not sure where to start. So we're going to hear this afternoon from Dr. Murray, who is going to take us into the cauldron. And we need to know that because actually if we don't know about this, if this part of the circle is missing, then we lose, we're adrift. We need to be connected with hurt. I know a lot of asset-based approaches say, let's not really focus on what's wrong, let's just look at what's good. And I agree with that, but I also think there's power in actually integrating the hurt and being aware of the hurt, speaking it, not getting stuck there, but not dismissing it either. And I would just say, as we go through the next 7 months, this is sort of the ground that we want to keep our feet in, is how is the work that we're doing in our teams, in our communities, sort of rooted in this sense of hurt and hope? How do we really kind of nourish the soil in that crack where hurt and hope come together with moral imagination, spirit power, love, really exploring what is love, what is that actually? What does it really mean? What does it really look like? Where does our power come from? What is the vision that we have? And how does that impact the way that we develop the work that we're doing over the next 7 months? Okay?